Okay, so this is it. This is a rather rushed version of my media and dialoguing psychology tricks, you can say, tips and tricks to debating people about circumcision, but with a particular focus toward confrontation with the outside world at large, toward arguing with doctors, interfacing with the media. Well, you'll see what I mean, and I'm about to just jump right into it. There's the most important stuff I've tried to put at the beginning, and although it's sort of haphazard, I would recommend you try to listen to the whole thing, because there may be a gem in there that I didn't put near the beginning. So let's start off at the beginning. If you're an intactivist, you are going to be dealing with people, particularly, you're going to be being looked at by the media and potentially interviewed by the media. And they're going to be hostile to you. You need to understand this. The media is not your friend. They're going to try to bring on a pro-circumcision doctor to rebut you. They may do it live on air. They may do it off air. So they'll pre-record you, and then they'll let a doctor respond. This last one is particularly problematic, because you can't really debate with them. You almost have to create their arguments for them and then beat them down. You almost have to throw up their straw men for them and then deal with them. Preempt and head off anything they may say. You must preemptively circumcise their argument. Okay, these next couple points, I would argue, are perhaps the most powerful points. I completely, in this sort of stream of consciousness, had completely forgotten to mention them. So I'm adding them here I want them at the beginning. Okay, first of all, female genital mutilation, we're going to talk more about it, and I probably already have talked more about it. I don't know where I'm going to edit this in the video. Female circumcision has medical benefits. I actually think that this kind of thing is going to you can invoke this even when somebody else isn't talking about female circumcision. But if somebody does bring up female circumcision, or says you can't compare the two, or preempts you and says you can't compare the two, and gets, you can say, female circumcision has medical benefits. Kanke et al. And Stallings et al. Have both shown independently, these were independent studies, have both shown an about 50% reduction in the rate of HIV transmission in circumcised African women. And people will say, oh, well, what kind of circumcision was it? Oh, well, it's described in the studies. It's well documented and described, the types of circumcisions. And they, a 50%, that's close to the 60% reduction claimed for circumcision. So why were those studies not the moment that they started petitioning for full-on randomized control trials of circumcising girls? Huh? If science was the pure motivator and this medical benefit was the only motivation, why the difference? Obviously, the respect for human rights, although differential, of course, the sexist, hypocritical, one-sided respect for human rights and cultural conditioning for the empathy of women kicked in and stopped, that was never even an option, and they cautioned against it. Keep in mind, Stallings, I believe, was a female anti-FGM campaigner who was out there specifically to try to prove that female circumcision increased the transmission of HIV. This is mentioned in the intro to the study. This is a very powerful point. This is one you can weaponize a bunch of different ways in different situations. Whether it's someone talking about the medical benefits of male circumcision or the lack of medical benefits of female circumcision, or getting angry about you for comparing FGM to male circumcision, or sort of a bunch of different ways of looking at that. Another thing, I think I actually mentioned it later, where I'm going to edit this in the video. I mentioned it again, but call these people baby rapists. Call them for what they are. Call them for what they are. Threaten them with lawsuits. Tell them there's going to be lawsuits. We are organizing. There's going to be organized mass lawsuits with advertisement campaigns to recruit plaintiffs. We are going to cause a death by 1,000 cuts in terms of lawsuits. We're going to make you bleed. We are going to circumcise the money from your wallets. And finally, they are going to be punished. Okay? You can tell them, obviously, this is for messaging. You can tell them they have dealt with very nice people. Lloyd Schofield, during the 2011 circumcision ban initiative, was a very meek, quiet man thrust into the limelight. And the people out there treated him like crap. Well, it is no more Mr. Nice Guy with the younger generation, okay? If the long-term prospect for these people is severe punishment. If I get my way, if my worldview ends up ruling the day, ask these people, how do you like the idea of spending your last days breaking rocks in a FEMA camp? How do you like the idea of being put in front of a firing squad? Keep in mind that forcible rape in this country was punishable by death within the past half century in parts of this country. Anyway, I'm going to edit this toward the beginning because these are important points. So enjoy the rest of the video. If it gets challenged to you, but circumcision has religious significance for Muslims and Jews, this is where you need to swoop in and say, no, we already have an ethical framework that denies genital mutilation on the claims of religious freedom. We deny it anyway. We already have that ethical framework that denies genital mutilation to religions that would claim to practice it. And as I said in a previous video, whether or not female circumcision is compelled in Islam is totally irrelevant. The fact, if someone believes it, if it's a sincerely held personal religious belief, it doesn't matter. The courts take that at face value and have to analyze some other part of it. They're not going to become a theological court to debate the theological merits in Islam of female circumcision.
On a final note, do not forget to imply that our enemies are the ones that are the pedophiles. I am routinely amazed at these people who sort of imply, you can tell they imply, we're somehow pedophiles. No. The people trying to cut off parts of babies' penises are the real pedophiles. Don't let them forget that. That's an important rhetorical point that you can use to make people look like garbage. So, go ahead, use that.
Okay, next point. The use of the phrase and the concept, you wouldn't cut off a finger to avoid a hangnail, or you wouldn't cut off a baby's ears, or you wouldn't... I mean, the finger one was probably the most on the point. people will tend to view this as sort of being petty and sort of metaphoric and unrelated, and you need to make clear that no, this is literal, because what is happening here is that the problem in doing this is that the doctors, the circumcisionists, do not acknowledge the harm of cutting off a functional part, a part, any part. We shouldn't have to prove the function. I think you'd be hard-pressed to prove the function of the earlobe, for example. But the inherent harm in part of a person's body being cut off and dying of ischemic necrosis, right? What happens when the blood flow is stopped, in this case when it's cut off with a razor blade. I have 2 videos talking about this in depth. The first one is Circumcision, Cut Off Your Fingers, which describes the logical fallacy of trying to cut off a body part in order to head off future problems. It's just not legitimate. The next point is related. It's what I was just saying. The fact that part of the idea that circumcision isn't harmful, or the only risks are pain, bleeding, and infection. No, it is inherently harmful. Okay, part of a person's body dying of ischemic necrosis when it gets cut off, when the blood flow is interrupted, that's what this means, is inherently harmful. And this was the second video I was talking about. The video I recently put out, entitled The Risks of Circumcision, which mocks this and points out that any other part of your body just randomly dying because the blood flow is disrupted is obviously harmful. A heart attack, an ischemic event in the cardiac muscle is called a heart attack. It's harmful. The same an ischemic event in the brain is called a stroke. It's harmful. An ischemic event in the lung is a pulmonary embolism. An ischemic event in the bowels is called mesenteric ischemia. It's harmful. It is harmful. Do not let them get away with this one. Another point. I'm sorry. I'm keeping this moving. The next point. Circumcision is unnecessary. I hear a lot of intactivists say this, and this is a mistake. Saying that it's not necessary is like, when you say circumcision isn't necessary, it's like saying changing your oil every 2,000 miles isn't necessary. Cleaning your furnace once a year isn't necessary. Oh, but it might be good. No. You can't say it's not simply not necessary. It is harmful, and I reference the previous things I just mentioned to show that it is harmful. Moving on. You may want to bring up the sexual function and the histological studies which have been done regarding the foreskin. I believe Taylor and maybe Sorrells has done different histological studies. The key study that I think needs to be talked about is the 2007 penile touch test sensitivity study published in the British Journal of Urology, I believe published by Sorrells. In which it showed that the ridged band of the foreskin and the frenulum are the most sensitive parts of the penis. And if anyone tries to challenge you on this with a study that came out just after that to try to combat it, make it clear that these people in this follow-up study that were trying to debunk the penile touch test sensitivity study tested the sensitivity of the foreskin. They quantified the entire sensitivity of the foreskin by poking the outside of it, the cutaneous shaft skin of the penis. What a joke! I mean, what a fucking joke. So you may want to bring that up. Moving on. Okay, circumcision affects children, right? The first implication of this, if there are children there, if some intactivist brought their kids with them, holy crap, you need to put them on the front line of wherever the protest is happening. You need to put them with the most confrontational signs, getting right up in the faces of the media and the doctors. The signs that say stop cutting baby penis, the signs that say that have images, visual imagery of infant circumcisions taking place. You need to get them up there because, again, people don't empathize with men. They don't empathize with the male members of our species in general, but they really don't empathize with adult men. The adult male is the most unempathizable creature within the modern social and cultural paradigm. And I mean, a lot of intactivists are adult men. So take advantage of this feature of human psychology that people empathize with children. I would really hope you could get some young boys out there holding these signs. That would potentially be very powerful. Moving on. Next point. A little bit of triumphalism goes a long way. You need to make clear, this is particularly one for interviews. If you're talking to a reporter, or you're being videotaped for an interview, you need to make clear the trends are totally on our side. You can actually say, there's a bit of a disconnect between the public perception and reality. The reality is that the circumcision rate is now 45% and falling consistently. It will be a tiny minority within a few years. This is a fact. This is an inescapable fact. It's almost an organic process. People think about circumcision. A certain percentage of them are always going to reject it. But the point here is triumphalism. Tell them they're losing. The trends are already written by virtue of the lack of writing, carving into the penises of the generations that are already being born. Make it clear that circumcised kids are going to be the ones getting made fun of in the locker room. That's a pretty powerful one. I mean, considering that was one of the crap excuses used in the past, it was never an excuse. It was never the actual excuse. But anyway, triumphalism. Let them know that we are, that we are destined by virtue of existing social trends, not prospective trends, but existing trends. We're going to win. Circumcision is going to die. It's just a matter of all the kicking and screaming between now and then. Okay, the next point. The media is going to tell the reporter, or even the doctors that you might be on a panel. They might put you up against a doctor, and you're going to be debating. This is one you may have to preempt. Like, this is an important one. Somebody, either the reporter or the doctor, is going to say, well, you should ask your local pediatrician about infant circumcision. Okay, this is where you have to mock the medical establishment. These people are trash, and they deserve to have their credibility undermined. And the phrase I use is, asking an American doctor about circumcision is like asking Jeffrey Dahmer about child rape, murder, cannibalism, and necrophilia. In other words, the answer is baked in. You need to ask a European pediatrician about what they say about it. Cite the Dutch Royal Medical Society's stance on circumcision, where it has no therapeutic or preventative hygienic use. It effectively is not medicine. this, you can also say, this is worth mentioning, that this is essentially a logical fallacy. The reporter or the doctor will be effectively asking you, the audience, to ask the party that is being accused, right? J'accuse. They are the party being accused of essentially the biggest ongoing human rights violation and genital mutilation conspiracy in the world. It is a fallacy. It is a logical fallacy. It is a fallacy appeal to improper authority. Or they will tell people to, quote, do the research for themselves. And this is where you need to make clear, no amount of research obviates the nature of the human rights violation of forced amputation. This almost gets into another point that I need to make, that this is a human rights issue, right? Forced amputation is a human rights violation to the human right to physical integrity. This is not babble, by the way. These are the words used by international organizations with regard to human rights. These are the words used by women's organizations. Forced amputation is a human rights violation, whether it is ISIS cutting off the limbs of accused pickpockets in Syria, whether it is East African clitoridectomies, and other mutilations as well, penile subincisions, cutting off the whole penis, right? I keep getting told that female circumcision is more akin to cutting off the whole penis. I don't think you could argue that cutting off somebody's penis would be a human rights violation. Foot binding in China, neck stretching in parts of Africa. These are human rights violations. You need to make that clear. Another point, another contentious point, especially with the use of the phrase male genital mutilation, is the notion of mutilation. And this is where you need to be clear that the word mutilate, like this is not an emotional. The people talking to you will be accused of being emotional when you say this, and you need to be clear. No, mutilation has a definition. Okay, and there's a couple different definitions. I made a video titled "Circumcision is Mutilation" where I talk about this. There are some better definitions of mutilation that I've seen recently. There's medical definitions of mutilation. That basically mean the excision or destruction of any limb, organ, or tissue. And at the minimum, the foreskin meets the level of tissue. It may some people have considered it an organ even. So it obviously is mutilation. There's not really any debate about it. And then somebody's going to try to compare it to appendectomy or wisdom tooth removal, and you have to say, well, we don't do that to infants. And also, wisdom teeth and the appendixes are not the center of the entire male sexuality. And also, those are both done in response to disease states. Appendicitis or impacted wisdom teeth. The comparison is ridiculous. Call the doctors baby rapists. They are. Overall, circumcision has strong overtones of child molestation, child rape, pedophilia. Not necessarily more child rape. In general, it has that imagery, but I mean specifically the penetration of the preputial orifice with a blunt probe at the start of a circumcision. It meets the strict definition of a penetrative rape. It's all academic anyway. I'm primarily concerned with the imaging and messaging of calling them baby rapists. Circumcision is not medicine. I sort of touched on this before, but this is an important thing. Because people will say, oh, but it has legitimate medical purposes, or they'll say, I'm against circumcision except for legitimate medical purposes. this is where you have to really... I don't think it's useful to equivocate here at all. I think we need to go full on, like I said, the Dutch Royal Medical Society. Circumcision has no therapeutic use and no preventative or hygienic use. Circumcision is not medicine. Infections are treated with antibiotics. Phimosis is not diagnosable until nearly adulthood, the average age of retraction being 10.5 years, with the edge of the curve trailing off into mid-late teenage years. But real cases of pathological phimosis are treated with stretching, steroid creams, and at worst, preputioplasty. And preputioplasty is an ultimate fix. It's a geometric problem. If you cut far enough back on the shaft and sew it wide enough, you can fix it. It is an absolute fix. Circumcision is not medicine. It simply isn't. The next point. This use of the phrase vaccination. It's a surgical vaccine. First of all, it isn't true. There is no such thing as a surgical vaccine. A vaccine is introducing a foreign protein and trying to get the adaptive immune system to produce antibodies to it. That's not what a circumcision is. But beyond that, again, I wouldn't even mention that. What I would mention is this phrase, circumcision is a vaccine, comes from a pedophile named Brian Morris. Okay, this originates with Brian Morris, or at least the recent desire to characterize circumcision as a vaccine dates to Brian Morris. Call them out on it. Tell them that they're citing a pedophile if they're going to call circumcision a vaccination. They're citing a child rape fetishist, a circumcision fetishist. That's actually a whole other topic. I just had to add this. The idea of circumcision fetishism. I mean, I don't know if the doctors will be interested in it, but it might be something interesting to say to a media outlet. That there are literally people out there in the world who are infant circumcision fetishists. They are aroused by the act, the mutilatory, bloodletting act of the infant circumcision. Or circumcision of children in general. And you need to make clear to them that this is not just something out in the ether. These people are literally some of the most preeminent people advocating and defending circumcision to this day. Brian Morris is a big one. Apparently Edgar Shane was also one of them. Both of them were associates of the Gilgal Society, this pedophile circumcision literature society. And this is not beyond the realm of possibility. Like I've said before, circumcision fetishism is where child rape intersects with BDSM, bondage, sadism, masochism, dominance. It's the intersection of those two categories. I recently realized and discovered that there actually is an adult subset of the BDSM community obsessed with even adult circumcision. This thing is a thing. This is a documented thing. The head of the Gilgal Society went to prison, Vernon Quaintance, for all kinds of weird sex charges, child pornography, and he was running around asking young boys whether or not they were circumcised and to show them their circumcision. It's the weirdest thing you can possibly imagine. Anyway. You may... What I have written down here is the comparison to female problems, right? A booty pinch or a cat call or even a campus sexual assault. These are the worst things in the world. They elicit all kinds of outrage. Meanwhile, male genital mutilation doesn't. I don't know if I'd go there, but I would dwell on the fact that this is perhaps the biggest. It is the biggest human rights violation ongoing in the Western world, there's no other social cause that can claim a bigger horror. Okay, the comparison to FGM. This is such a big topic, it almost deserves a video on its own, and it's so difficult to hash out. I haven't done it yet, and I really should. Right, they're both carried out on minors, people who can't consent by definition. They're both surgeries, they're both amputations, they both deal with the genitalia. And they're both, in fact, mutilatory in nature. They're both mutilation. In the strict sense, they seem totally comparable to me. There are certain things you may want to talk about. You may want to talk about the 20,000 nerve endings in the foreskin versus the 8,000 in the clitoris and the 4,000 in the glans penis. People may be interested in that. People will claim that FGM is to diminish sexual pleasure, but that male circumcision isn't. I guess you can cite Maimonides, but you also need to cite people like Kellogg. You need to cite the writings of Kellogg and make it clear. People will get in a huff if you quote Maimonides. They'll say, "Oh, well, you're citing 5,000-year-old religious figures." Well, they seem to know, they seem to have a very good idea of what they were doing. But cite the fact that the medical community itself bought into this idea that circumcision damaged the sexuality and therefore it was a good thing. That's an important point. And that's one that I've never seen them called on. Then the actual claim of does it prevent, a woman from achieving orgasm, and this is where I have some important studies. A guy wrote an article, Orgasm in Ritually Circumcised African Women, printed in the First International Conference on Orgasm, New Delhi, February 3rd to the 6th, 1991, by Hanny Lightfoot Klein. And he interviews some circumcised women in Africa, and it's sort of a mixed bag, but he concludes they certainly can orgasm. Some more interesting things I found. It's on www.circumcisions.com/fgm-sex.html. The title of the page is Female Genital Cutting and Sex. Female circumcision does not reduce sexual activity. British Journal, an International Journal of Obstetrics and Gynecology. They're debunking the claim that it makes them less likely to engage in sexual activity. The second part of this, an article by Emma Young in the International Journal of Obstetrics and Gynecology, Volume 109, page 1089. That was that previous article. The next article is the Journal of Sexual Medicine, 2007, Pleasure and Orgasm in Women with Female Genital Mutilation Cutting. Basically, the conclusion is that they still have ability to experience sexual pleasure and climax and orgasm. The claim that they can't is just false. Not that in any way affects the nature of the human rights violation of the forced amputation. If you're arguing with people and they say, well, it happened to me, my husband, my boyfriend, brother, or most tragically, my son, it didn't hurt him, me, whatever. I'm fine, or he's fine. this starts with, you have to point out to them, it starts with the premise, or that you're starting with the premise, it happened to me, therefore it can't be bad. This is a faulty premise. This also gets to the heart of another problem, which is, I'm fine, all these men are fine, the world keeps going around. I just have to say, the world keeps going around despite the fact that women are being circumcised in Africa. The world keeps going around despite the fact that ISIS is cutting off people's heads in Syria. The world kept going around even though horrendous human rights violations were taking place during the Second World War. Hannah Arendt, in her Eichmann in Jerusalem, talked about this concept of the banality of evil. Now, there's a lot of debate about exactly what this means and exactly what she intended, and there's been attacks on her character, and the Jewish community argues a lot about it, and a lot of them don't like the comparison being expropriated for anything else, which is ridiculous. But this is the banality of evil. Babies are being raped. And life goes on, but babies are being raped and mutilated. It's the banality of evil. It is the banality of evil. Where a Polish family would be sitting down to dinner in Auschwitz, right? 50 feet away, and 50 feet away there were people being worked to death in a concentration camp, right? It's the banality of evil. Also, regarding the comparison of circumcision to vaccination, again, vaccinations don't involve amputation. Can we at least agree, if somebody brings this up, can you just say, can we at least agree that amputation is more invasive than a vaccination? My God. By the way, this is another point. They will claim that this is not amputation. I guess they're claiming it's not a tissue or organ, therefore it's not amputation. It's not a limb or organ, it's only a tissue. The 1999 AAP circumcision report describes circumcision as the amputation of the foreskin. The organization you're protesting, it describes it as circumcision as an amputation. No argument here. Okay. Again, amputation is the harm. The current AAP conclusion that the risks outweigh the benefits, but again, not enough to recommend it. This is not a scientific analysis of risks and harms. Again, they don't include the death of part of a body part as being in the harms, but even still, even that aside, it is not a scientific analysis. It was pure editorializing by the American Academy of Pediatrics, and it was not a representation of any real harm-benefit analysis. The next point is that non-therapeutic procedures have a different. It's not risk-benefit analysis. It's harm-benefit analysis. And because there is no disease being treated, any possible harm, even the risk of infection, pain, bleeding, much less the death of part of the body, makes it totally unacceptable. Finally, moving on, debating the studies and the benefits of circumcision is with anybody on the news or a doctor, it is going down the rabbit hole. you're going to be chasing them study after study, trying to debunk. You're going to be constantly on the defensive. You basically have to make clear that this is a human rights violation. It's child rape. Cutting off part of a baby's penis is child rape and genital mutilation. Use the fundamental terms. Cutting off part of a baby's penis. Cutting off part of a baby's penis. Cutting off part of a baby's penis. Somebody cut off part of your penis. God. The use of ethics and human rights as a trump card. Right, there are fundamental pillars of medical ethics. They include informed consent, do no harm, do good, proportionality of treatment. Okay, this is about using ethics and human rights as a trump card. Medical ethics has well-defined principles, including physical integrity, bodily autonomy. Those are like the same principle, and that is a human rights principle. That's where that comes from, as well as informed consent, do no harm, do good, and proportionality of treatment. Use these as battering rams. Circumcision, it obviously violates physical integrity. It violates informed consent because it violates informed consent in multiple different ways. One in which the parents are not actually informed, but the person who needs to be informed, which is the person whose penis it is not the one being informed. It violates the do no harm principle because part of somebody's body is dying. It probably violates the do good principle, and it obviously violates the proportionality principle. I mean, if there's no disease in the first place, then there can be no intervention. That's the proportion. But even if there is a disease process, say infection or phimosis, you are obligated to use less invasive forms of treatment. The amputation is the harm. Even if the benefits were true, circumcision is unacceptable because there is no pathology. Here's the catchphrase. Without pathology and diagnosis, surgery, much less amputation, is unacceptable. Another zinger, sort of, is, well, it wouldn't matter if circumcision made him fly through the air like Superman or walk through walls or have superhuman strength. This is a human rights violation. There's no benefit, no 50, claimed of marginal reduction in HIV transmission in third world populations makes this okay. Early 20th century thinker and playwright Israel Zangwill had an idea where people should be held to their own standards. When you can convince somebody or make it obvious that someone isn't just violating my standards, but they're violating their own, that's powerful. And that's effectively what we need to do with medical ethics, with regard to medical ethics and circumcision, is make it clear that doctors are violating their own stated principles. That's important. That's powerful. Penis size. Okay. I never thought that this would actually be an issue with doctors, because it's something so juvenile. It's something you'd expect some dumb young guy to say. But there was a video recently posted on the Bonobo 3D channel where some Arab doctor is arguing with intactivists about the idea that circumcision doesn't reduce penis size. Aside from the fundamental problem, the definitional problem of cutting something off something makes it smaller, there are even further studies that analyze the length and size of the adult penis compared, to the intact uncircumcised cohort. And what they found was... What did they find? The tissue removed accounts for roughly 50%, sometimes more, of the mobile skin sheath system of the penis. a 2 millimeter reduction in girth behind the coronal ridge and 4 millimeters reduction at the glands. And the real clincher is the fact, okay, I found it, the fact that the circumcised cohort had an average penis length that was 0.8 centimeters shorter than the intact cohort. Now you can say the girth thing, that's sort of the definitional part of it, where you cut something off, it makes it smaller. This length thing is very disturbing, because what it says, and I assume they were measuring from the tip of the glands, not the tip of foreskin overhang, but although there's an argument there, right? If you're flaccid in the locker room, it's going to look bigger just by virtue of foreskin hanging over the edge of the glands. The Greeks were big on that. But what this says is that there's something much deeper. It's been theorized that it probably disrupts blood supply to the entire penis, and that the frenular artery basically has to be severed during circumcision. It's simply the way it works. And that this disruption of blood flow decreases the amount of nourishment to the penis during, as the child grows, and the end result is a 0.8 centimeter reduction in the length of the penis. There's actually another study that just came out in the Canadian Urological Association Journal, 2016, September, October, published online 2016, September 13th, called The Prospective Investigation of Penile Length with Newborn Male Circumcision and Second to Fourth Digit Ratio. And they found almost exactly the same thing. They confirmed previous studies. Where to go? Okay. A final point is sort of one for parents, although saying it in the media may be good too. Ultimately, what conversation do you want to have with your kids when they confront you about circumcision, if they ever learn about it? Right? Do you want the conversation to go something like, oh, well, you have a whole penis. They cut parts off of other babies' penises. Do you want it to go like, you have a whole body. You're okay. Do you want it to go like that? Or do you want it to go like, oh, well, son, we cut off part of your penis because you need to look like daddy. Or some nonsense about hygiene, or, which again is nonsense. Actually, that's another point I need to mention. Some other nonsense, but there's a study I just saw, and I think you need to see this one, which is a study on the parents' rationale for infant circumcision. And what it found was, it's called Parents' Rationale for Male Circumcision, Chris Rediger and Andreas J. Mueller, the Canadian Family Physician Journal, 2013, February 2013. And it basically states that parents will mention hygiene, they'll cite hygiene, but in fact, it is the circumcision status of the father that is the most predictive variable of the stance on circumcision of the parents. In other words, it's not about hygiene, it's not about anything else, it's about looking like daddy, which is so transparently not about the kid. It's about the psychological, reaffirming the psychology of the parents and not having to confront things that happen to them. Look like daddy. I've noticed that during these conversations that on the rare case where kids confront their parents about circumcision, it's the parents never tell them that they need to look like daddy. They'll never say that then. They'll say crap about hygiene, which is illegitimate, because amputation is not a legitimate hygiene measure, soap and water is. Or they'll say something even more ridiculous, like you had a birth defect. Being born without a foreskin is a birth defect called apostia. Okay, getting to the final point. This point about hygiene. Okay, obviously, there's nothing that would ever convince you to circumcise a girl. No hygiene problem. But it gets much deeper than this. When they say you need to... Right, women have this, like, cult around their vaginas. Ooh, my clitoris. Ooh, my vagina. My pH. My good bacteria. These same bacteria... And I used to say this off the cuff, but I've now actually found studies that confirm that the bacterial fauna of a female's vagina is the same cross-section as that of the intact penis. And indeed that circumcision destroys it. But this is interesting to me, because it's those same bacteria, the women, these bacteria on the women, oh, that's good bacteria, oh, I gotta keep my pH good, oh, those are my good bacteria. But on men, those same bacteria, that's a cause for saying he has a hygiene problem, and he now deserves forced amputation of part of his genitalia. Oh, that brings up another thing. People who say that infant circumcision is not forced. Okay, if you have to tie a screaming infant down to a plastic BDSM torture board in order to cut off part of his penis, it's a forced amputation. If you don't have his consent, that's forced amputation. Okay, another point, but this just goes on forever. It is apparently being debated by the organized medical community. This is an item that should not be debated. I mean, but the debate item is whether or not you can perform non-therapeutic procedures on non-consenting infants and children. I guess they're claiming that you can. My case is that it's totally illegitimate, and in practice it is not permitted. Right? There's no other non-therapeutic surgical intervention I could perform on an infant and not go to jail. I couldn't perform female circumcision. I couldn't cut off a kid's ears. I couldn't do anything. I couldn't do breast enlargement surgery. I couldn't do penis enlargement surgery. I couldn't do prophylactic breast bud removal. So in practice, this is already not permissible, and this is the violation of an existing de facto principle. Another problem or a way of confronting this notion of, well, I'm circumcised and I'm fine, is obviously to point out that there's no way you can know you were fine. You can never know you were fine. However, we can know that we're not whole. We can research. We can look at the histology studies. We can look at the studies into sexual behavior and the penile touch test sensitivity study. But beyond that, what you need to do is mention the 4.5 times increase in the rate of erectile dysfunction drug use. 4.5 times increase in the rate of erectile dysfunction. Studies out of, I believe, the Netherlands that suggest all kinds of sexual problems, dryness, pain, bleeding during sex in the circumcised cohort, looking at the men and women and asking the women, and also the fact that the women will, a certain subset of them will report that they prefer circumcised, but also claim to have less pain, bleeding, and discomfort during sex with the uncircumcised intact partner. It's another point. Okay, one last point. There's a guy on my channel who basically makes the case that intact men do not choose circumcision for themselves, which means that doctors know, they basically, by definition, know that they're doing something that intact men do not choose for themselves, and therefore it is a violation. It is an obvious violation, tantamount to rape. And I agree with this sentiment. I like this angle. Men who make it past childhood intact do not choose circumcision. Okay, in Finland, it's something, the circumcision rate is effectively something like 1 in 17,000. Even in the circumcisionist USA, the circumcision rate among the adult circumcision rate is maybe 1 in 200, and that's in a culture that has a culture that is negative against the natural male human body, and also a medical culture that is willfully negligent and engages in routine malpractice in genuine problems of the adult male genitalia. Intact men don't choose this. And another thing I saw was that doctors don't choose this for their own children. And this is even more telling. Apparently doctors have a lower the children of doctors have a lower circumcision rate than the prevailing population in this country. That tells you everything you need to know. They didn't want it for their own children, but they'll inflict it on others. These people are evil. They're evil. I'm sick of this. But these are powerful arguments you can use at your discretion. That's about all I can think of for now. This was really haphazard. I don't know what you can glean from this. Maybe listen to this as a podcast, as you go to sleep tonight or as you're driving tomorrow morning to get there. I don't even know. Just some good advice for you. I'm going to hack this together in the editor and upload it. Boy, is it going to take forever. This is almost 1.5 gigabytes. Okay. Good luck tomorrow. May the foreskin be with you. Bye. Give him hell!